Hi everyone, welcome back to S.P.C Therapy. Welcome back to the second part of vaccination, vitamin D and COVID-19. We will be speaking on vitamin D, continue to look at the effects and the importance it has on our health. As well as this, we'll look at the signs of vitamin D deficiency, and then as a conclusive work, we will then relate it back to COVID-19. Vitamin D has a major role when it comes to muscle health. We're talking about muscle development, muscle growth. Specifically, we're looking at muscle contraction. We also understand vitamin D is very important when it comes to your bone health. At a certain stage of adulthood, bones will stop growing. But what happens after this is that when they stop growing, your bone tissue will frequently be replaced with new tissue, with new bone tissue. And the process that does this is aided with vitamin D. So now you can see the important role vitamin D plays when it comes to your bone. I know in general that vitamin D does help with bone growth, but now we also know that it helps with when it comes to the process of replacing your bone tissue, which needs to happen frequently for your bone or for your human skeleton to continue to support the rest of your body. Vitamin D is very, very important for the health of the neurons. So we're talking about the brain cells here. And it has been proven, it has been shown that many neurological disorders or conditions are linked with vitamin D. And a prime example of this is multiple sclerosis. So now you can see that vitamin D plays a major role even when it comes to your brain, to your mind, to that wonderful thing over there. We also know that vitamin D is very important when it comes to something or a condition known as SAD, and that stands for seasonal affected disorder. And that's very important because it affects your overall mental health when it comes to the winter season. Vitamin D plays a vital role when it comes to your body's energy. You don't see the sun, you feel low energy. You don't feel motivated, you don't feel like doing anything. As opposed to the day when you open your curtains and you see the sun shining, you feel that energy, you feel that motivation to get up and do something. Now this brings me on to vitamin D deficiency. So we're looking at signs which can tell you maybe you are vitamin D deficient. And to start things off, feeling bone pain and muscle pain, or you're feeling muscle pain, bone pain, both of these could be a sign that you're vitamin D deficient. Now, how would you differentiate between the two? The difference between bone pain in contrast to muscle pain is that when it comes to bone pain, it's not in one area. So you'd feel it being in different areas, but within that region. And to give you guys an example, if you are having bone pain, which is in your hip, you could feel this all the way up to your upper back, even sometimes in your shoulder. But you wouldn't really know where this pain is coming from. When it comes to muscle pain, it's aggravated by physical movement. We say it's localized, and if you are constantly getting this and the treatments are non-responsive to this pain, then this could be a sign that you are vitamin D deficient. And this is something important for you guys to understand when it comes to differentiating between muscle pain and bone pain. One is quite localized, the other is quite globalized, meaning its spread is in different areas. So we said that when it comes to bone pain, vitamin D helps with the process of frequently replacing the bone tissue, so making sure that there is a stability in your bone health. However, if you are seriously vitamin D deficient, then this process is affected, which would leave your bones to get softened, and then you'd have something called soft bones, or also known as osteomalacia. And this is basically your bones turning soft, and this could affect how your bones function in terms of supporting your joints, supporting your muscles. Also, because you've got soft bones, it would make it prone or make it easier for it to fracture or break completely. Now this brings us to the next symptom or sign of vitamin D deficiency, and this is fatigue. We know that fatigue is controlled in the deep compartments of the brain. We also know that fatigue is related to vitamin D deficiency because, as we've explained previously in the earlier part of the video, that there is a great research that shows that vitamin D affects your body's energy. If you're feeling tired without having to do anything, and you just feel that low energy, you don't want to do anything, you feel lazy. And bear in mind, this could lead on to other complications, because if you're feeling low mood, low energy, you don't want to do anything, this has a major effect on how your body functions. And this will develop something called sedentary behavior. And sedentary behavior is something that you not having the motivation to do anything with your day. You may be someone who is active, but at the same time, for no reason, you feel that drop of performance. You just feel like you don't want to do anything. Your whole mood changes. And this is for no reason. This is fatigue. And at the same time, it could be related to vitamin D deficiency. We now also know that vitamin D affects your limbic system of the brain. A limbic system of the brain is found in the frontal lobe. So we are talking about, so this is the frontal lobe, as you can see. Now, the frontal lobe of the brain, this is where you'd find the limbic system. And the limbic system is something that basically controls your emotions and your mood. So if you're feeling low moods, and this is for no apparent reason, it could be another sign of you being vitamin D deficient. Vitamin D has played a major role when it comes to developing obesity or putting on excessive weight, because we understand that vitamin D plays a major role when it comes to processing calcium. And we know that calcium is important, of course, for bone development and bone health. But calcium is important for metabolism. Metabolism is very important for burning calories. So if you're vitamin D deficient, that means your body cannot process calcium well. And because of this, you're putting on those calories, or you're not burning enough of those calories. So you're storing this, which then goes on to become excessive fat in the body. And again, there are other studies which has linked obesity and vitamin D deficiency, because we understand fatty deposit tissues makes it more difficult for the body to absorb those ultraviolet B rays, then the cholesterol to be converted to vitamin D. And we also know that people who are obese, they need to take a lot more higher dosages of vitamin D for the body to utilize. Feeling dizziness, nausea, and you feel like everything around you is spinning or moving, but you're not. And this is making you lose your balance and your locomotion, so basically the way you conduct yourself, the way you hold your balance, and the way you distribute your weight from one side to the other side. Then this could be sign of vitamin D deficiency, and how it has affected your vestibular system. We know that within the vestibular system there are vitamin D receptors. It is important to understand if you are losing your balance for no apparent reason, and you feel like things are spinning around you and things are moving, which is causing you nausea, and you don't know how to hold yourself up for no apparent reason, this could be another sign that you are vitamin D deficient. If you want to know more about this, then I suggest that you look into benign proximal position vertigo and vitamin D deficiency. Vitamin D deficiency has been linked with high blood pressure. Persistent high blood pressure could lead on to things like stroke, heart diseases, heart problems, kidney problems, and much more. And this ties in nicely with how vitamin D deficiency can lead to something known as stroke. And stroke, for those who don't know, is basically your brain being cut off its blood supply or oxygen, or the oxygen or blood supply to the brain has been restricted. So we can see here the importance of vitamin D when it comes to the brain health, or the cells in the brain, or the neurotransmitters in the brain. What we've also found, and there is excessive amounts of research around this, is vitamin D deficiency and how it is linked with Alzheimer's and dementia. Right guys, time to conclude everything. We looked at vitamin D, and we looked at vitamin D deficiency, and we looked at how vitamin D plays an important role when it comes to the human body. So how can all of this be related to coronavirus, or SARS coronavirus 2, also known as COVID-19? We understand when coronavirus, or the virus, this particular virus comes into you, your body, your immune system, which normally is very good at dealing with infections, getting rid of viruses, bacteria, but Because the immune system is not familiar with this particular virus, it knows that it needs to get rid of it. It's like it panics, and this panic causes a lot of inflammatory responses. So when we're talking about the inflammatory responses, we're talking about infection and immunological inflammatory responses, which causes a lot of inflammation. All this inflammation will end up causing a lot of complications in your body. Because your immune system doesn't know how to react, and it is overhyped and causing all these inflammatory responses, which causes a lot of issues to the tissues and organs and cells, what we actually need is a good balance of your immune system. A balance which is enough to fight the virus and get rid of it without causing all these inflammatory responses. Remember the role of vitamin D and how we can immunomodulate, meaning it's got this immunomodulatory effect, meaning that it can balance your immune system, meaning that it can increase or decrease it, and that's what we need. We need vitamin D to decrease your immune system so that there is less of these inflammatory responses, but at the same time we want it to be effective to get rid of the virus. So we want your immune system to decrease to stop these inflammatory responses, but at the same time have a good balance to be effective enough to get rid of the virus. And that's what vitamin D can do. Again, this is not something we pulled out from out of nowhere. This is something that has been proven in research in a small clinical trials. However, we are hoping for a larger clinical trial. So the part where I mentioned at the beginning about vaccines not being the cure, what I was talking about is that, yes, a lot of us are waiting for this vaccine and, we think it's going to be the cure, but it is not the cure. It's your immune system that needs looking after, because fine, today it's coronavirus 19, or SARS coronavirus 2, COVID-19. But what about tomorrow? What if there's something new? All these vaccines are going to be ineffective against it. But your immune system can still fight it. However, it needs looking after. And the vaccines, what they do, they actually reduce the symptoms of coronavirus 2. It doesn't actually help your body to get rid of it completely. To clarify, what the vaccine actually does, it trains your immune system to be able to fight the virus, the coronavirus. But it is not the cure, and that's very important to remember. It is not the cure, rather it trains and makes your immune system familiarize itself so that when the real thing enters it, it knows how to deal with it. That's what these vaccines do. Train your immune system. You need to look after your immune system. And how you do that, according to many studies, is that you do not smoke. So don't smoke because it affects your immune system. You need to sleep well, eat well, have plenty of fruits and vegetables. If you are drinking, of course, you should avoid alcohol. And if you can't avoid alcohol, then drink with moderation. Stick to the guidelines. There has been plenty of research which has linked the severity of coronavirus and drinking. That's why you see the government having these strict rules when it comes to drinking. So get rid of bad habits and start adopting good habits which can affect your immune system and give you the ultimate cure with no side effects. And that's the main point I wanted to make. In case, people misunderstand and they think, I'm on the side that says that, you shouldn't be taking the vaccine. Because I do think the vaccine is very important for those who have poor immune system. And we know that immune system is affected by age. But again, the rate that it decreases, it all depends on how you looked after your body. So if you had the habit of looking after your body from the younger days, then when it comes to the senior days, the rate that your immune system decreases should be much slower. Right guys, so that's everything that we had to share with you. I hope that you guys have enjoyed this short journey, and I hope that you guys can take this information and use it and share it, because at S.P.C Therapy we believe in education. We believe in educating the masses, because only then we can move forward together with knowledge. You can stand against all this false information that's being passed around, and you can come together and fight this virus, fight this pandemic. We're always saying that when are things are going back to normal. But the sad reality is, for some people, things will not be going back to normal. A lot of people have lost their lives, which has affected families, broken families. So I urge you guys to look into this research. Everything that I have stated is from research, from journals, from studies that we have looked at. And these things are available to you guys. And if you want access to it, we will guide you towards it. We'll give you all the information you need. If you guys have enjoyed these videos, do give us a like, do share, and subscribe.